thank you for the lovely introduction. And as I said, my name is Margaret. My husband and partner is Alan. And we live in Redondo with our kids, Angel and Zorro, who just celebrated their second birthday with us. Thank you, Tony. So, as we alluded to earlier, I was under the care of Dr. Orringer. Oh, we need to go back one, my friend. I guess I didn't send, there you go, right there. Just if the blank screen. Okay. That's perfect, thank you. I was under the care of Dr. Orringer and you wonderful folks at St. John's and the St. John's team almost 3 years ago for my bilateral mastectomy and my stage 1 reconstruction, and stage 2, I think, actually. And so I'm very excited to be part of this pilot. And I made some notes I'll be referencing, but I wanted to lighten it up a little bit and do really 2 things with you: is share the experience from my point of view as a patient. The doctor taught me a lot of things and really reiterated what a tough job you all have every day. So maybe share a few thoughts and observations of my time and the journey, and then a couple observations that I would just like to leave you with to think about, maybe before the end of the day. Consider if there's something we can do more of or less of. So that's what I'm hoping to do with the next 20 minutes, and we'll leave it interactive. You know, it's not like, again, talking heads. We all just like talking heads. So if I could, let me start with the beginning of the story, and I'll hit the high points. In late April of 2012, I went for my annual mammogram. And about a week or so later, I received a call from the radiologist. And you'll have to forgive me if I don't use medical speak, because that's not the world I come from. So, and she said, Margaret, you know, we found something in the mammogram that looked a little suspicious. So don't worry. And I was worried because I watched my mother pass away of breast cancer at a very early age. You know, only 5% of this ever turns into anything, don't worry about it. But we'd like you to come back in for another mammogram. So, you know, I go home and I schedule another mammogram. So I go, I have the second mammogram, and a few days later get a call and they say, you know, we still see the suspicious area. We'd like you to come back in and now have an ultrasound. So can you make an appointment? So I go home and make an appointment for an ultrasound. So Alan drove me in to have my ultrasound, and the doctor tells us we found something suspicious on the one side, but don't worry, only about 5% of these things ever turn into anything. So would you please make an appointment for a needle biopsy? So I went home, I got on the phone, and I made an appointment for my needle biopsy. Alan took me for my needle biopsy. Has anybody here ever had a needle biopsy? Yeah. It is the most weird, crazy process, you know, and not being a medical person, I was just shocked at the whole thing. So anyway, crazy process. And then so I'm home, and a few days later I get a call that they have the results of the biopsy. And they'd like me to schedule a meeting with a nurse. So could you please, so I get on the phone and make another appointment to schedule the meeting. So Alan and I go to see this nurse. Her name was Nina. It's amazing how I remember certain things, and we'll come back to that in a second. I can't remember what I had for breakfast most times, but for some reason, these important things in life stick with us. So we met with Nina, who was very kind and very nice, and she said, Margaret, I have great news. There's no cancer. She said, but we did find, and tell me if I'm saying this right, atypical ductal hyperplasia, potentially precancer, I guess. And she said, don't worry, 95% of these things turn into nothing. So at this point, I'm buying lottery tickets every day, because I'm thinking, if I'm part of the 5%, I gotta be one of the 1% that hit the lottery pretty soon. But so Alan and I go in, and Nina suggests, Margaret, protocol in California is that you have it removed, that type of a precancer. So she gave me a list. She gave us a list of surgeons that were in the Torrance area, and I went home and did a little research, and then made an appointment with a very well-respected breast surgeon in Torrance. So a few days later, Alan and I went to see her, and she suggested a lumpectomy. But she said, before we do the lumpectomy, we'd like to do an MRI, because we want to make sure there's nothing else in there before we go in. So, okay, I go home, and I have a job, right? I go home, I get on the phone, and I make another appointment for an MRI. So we go get the MRI, we wait a few more days, and the MRI reveals another area of suspicion around the original spot that they found. So I call the breast surgeon, I call my primary, I call my sister, who I'm fortunate is a doctor, and we all agree, you know what, let's just go in and do the lumpectomy. This area is so close, so we'll go forward. So I went in for what I refer to as wire-guided, AKA ouch, lumpectomy, because that was, and Jay knows this, I am a big pain baby. I think it's one of the reasons I've never had children. So all this poking and prodding was quite new to me. So a few days later, I am at home working, and I see the name of the surgeon come up on my phone, and I pick it up. I'm sorry. And she tells me they found cancer. I was in shock. And so she wanted me to come in to see her to discuss the treatment options. And I called Alan, and he came home, and we both had a good cry. So this is where I would like to introduce my first takeaway as a patient that I'd like you to consider. This ain't my first rodeo, and what I mean by that is, by the time a patient gets to see you, we have been, and in this case, my case, it's now been 2 months into my journey, and we have spent almost every day being poked, prodded, scheduled, herded, ignored, and thinking about cancer every day. So, and it's not just me, it's my family, as you guys have been talking about. So I would just ask you to think about when you see us for the first time. We have already been through a lot, and I'm scared and just really want your love and your support and your empathy. So I knew, I meant to bring the tissues up with me. I knew this was going to happen. I saw a couple of you guys today, and it just did me in. So, thank you. Blank's good, blank's good. So we spent the next few days in shock, and went to see the surgeon that was recommended, and she recommended to us a treatment plan. And the treatment plan was hormone therapy and radiation. And I called my primary care, who's also a good friend. I called my sister, who I mentioned is a doctor. And she says, Margaret, I wouldn't go that route yet. I really would consider mastectomy and reconstruction before you make that decision. So I thought, what? I'm supposed to be in the care of the experts. And my sister said, without even asking, she said, Margaret, before you make the decision on that first course of path recommendation, consider mastectomy and consider reconstruction. So I was so confused. We're not medical people, we're business people, we don't know. So I called the original breast surgeon back, and she said, Margaret, the hospital reviewed it, our recommendation stands. We think you should do hormone therapy and radiation. So I was totally confused. So I thought, you know what, here we go. I decided that I was going to take some time and do my homework myself and do what was right for me. So I became, and my husband will attest to this, an absolute woman on a mission. I was like a dog on a bone, and spent the next several weeks talking to anybody that would listen to me, past patients, doctors, surgeons, oncologists, nurses, breast cancer support groups, you name it, and trying to learn why people suggested and chose the path they did and why they didn't. So then my sister gave me the best advice ever. She said, Margaret, you are only 52 years old. I know, you thought I was younger. And she said, no one can guarantee you will never have cancer again. There is a chance it will come back. There's a chance. So she said, my advice is pick the path that gives you the most options for the future. And given my history of being the only one in the 5%, that made a lot of sense to me. So after being 2 months of this work and being my own advocate, I decided on a path different than the original, which was to do the mastectomy and reconstruction. So now I decided that with Alan's support, I don't mention his name all the time, but needless to say, every step of the way. So now I needed a team. And I, again, started to talk to past patients and did internet searches and met with several surgeons to find the best fit. And after a few weeks, I made my decision and picked the best team, which was Dr. Christy Funk and of course, Dr. Jay Orringer. And just for the record, I did that long before Angelina. So I think we were the smarter. So anyway, I even went to see a hypnotist because I was so deathly afraid of medical stuff and fluids and yucky. So to help me kind of get over that fear before I went in. So this brings me my second observation. I only have 4, this will be quick. My second takeaway I'd like to suggest. Does anybody know what this saying means? Big hat, no cattle? It means I came to realize that big hat Margaret Dano, who's the chairman of the board of several companies, and blah, 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 I now have no cattle. I have, please. I'm turning everything over to somebody else. I'm used to being in charge of everything all day long. And now, the scariest thing for me is I have to let go. I have to trust my team. And I thank God for my team. And it is really, really scary for me. So, can we flip to the next one, please? Thank you. So, I had pre-op for my delay surgery. It's a surgery Christy does to help you get ready. And then Dr. Funk performed that surgery. And then I gathered all the must-haves that I'd learned about from all my research. A cushy pillow for the ride home, so your butt and your aren't sore as you drive in the car. The special sit-up pillow in bed that you need. So I did thousands of sit-ups to help get my core in shape so you guys wouldn't have too much of a difficult time moving me around. I even got the obligatory PJs and clothes that had a zip in the front and button in the front. You know, everything that I was told I needed to get, I put my attentions into that. I completed the pre-op for my mastectomy, and the night before my surgery, I just prayed a lot. So the next morning, I go to the hospital bright and early. Alan is an early riser, and I know I'm going to see Dr. Funk and Dr. Orringer, who I know, but I have no idea what the rest of this St. John's experience thing is. I've been very fortunate not to have to visit hospitals. So I was optimistic but skeptical given the way we'd kind of been treated in the past. So my first stop was check-in, and they didn't have me wait long, and the woman was very, very nice and very pleasant, and I thought, oh, this isn't bad, this is pretty nice. So I was feeling a little better, and then I met the wonderful pre-op nurse, and she smiled, she greeted me, she was warm. I mean, she didn't think anything I said or asked was stupid, and we're nervous, so we make dumb jokes and stuff, and as being a patient, I'm thinking, oh, this is pretty good. I'm 2 for 2, and Alan's there, and he's not bothering anybody, and they're not mad at him for taking up space or anything like this. And so we meet several different doctors and nurses, and then I see the familiar faces of Dr. Orringer and Dr. Funk, and so I'm feeling much more comfortable. This big hat, no cattle thing is starting to feel a little better to me. I'm starting to let go, and I am starting to realize I really can trust this team for the next day or two. So I kiss Alan goodbye, and they wheel me in, and I'm saying a prayer, and the next thing I know, I wake up in recovery, which takes me to the third and of the fourth that I'd like to share with you is we really we don't get a second chance to make a first impression, and patients are with you for a day or two. And if I could ask for the next one, the importance of that I'd like to have you think about is, from the very first time you meet a patient, you don't even have to say anything. It's just the smile. It's how you look. It just takes away so much fear. I can't even describe it. So just my encouragement would be really just that first interaction is so important. It doesn't have to be big. It can just be so small and so subtle. So just reassure people that you're there for them and let them see from the beginning that it's real. So I'll bring her home. So if I could go to the next slide, please. So my first memory was when I woke up was, thank God I woke up. I remember that thinking, because they warned me it was a long surgery, and then I wanted to know about the pathology, but is it in the lymph nodes? But I didn't know that yet, so I was nervous about that. I remember being wheeled out of recovery up to Caritas, and the room kind of looked familiar, so that was kind of cool because I'd seen it on the website, so I knew what I was going up to. And we wanted to pay for the upgrade to Caritas, not because of the room, but because of what we perceived to be the peace and a little more quiet and the care that we would receive from the Caritas. So I was so happy to see Alan, and I wondered what my chest looked like, but I was really afraid to look, to be honest. So then I never thought I'd be thankful for a catheter, but I was, because it was like, whew, one less thing I don't have to worry about that. So that was fun. And then I heard the words that they got all the cancer. Lymph nodes were clear, and I was healthy so now I knew I just had to focus my recovery just on healing from the surgery. So sleeping that night, I remember being absolutely impossible because of that damn machine you use about breathing, like it's important or something, but I didn't sleep very well. I was sore and cranky and tired. And Trisha and Frank are two names that stay with me to this day. I was so happy to see them today. Because you guys were amazing that night. You guys were prompt when I needed help, pleasant. I think you laughed at like two really bad jokes I made. You were very proactive, you were patient with me, and you showed true care. I show your pictures to friends and family with that big dog that came in. So I woke up the next morning to much more activity and realized these guys had gone home and thought, we've got a new team now. I see how this goes today. And I I was asked to not candy coat today, so I wanted to share with you. I'm afraid I didn't have that experience with everybody. The vast majority of folks that I had encounters with treated me exactly the same way. But others when people get so focused on being busy, it feels like as a patient, they're just doing their job, and the empathy part or the compassion part gets lost. So I saw people do hard work, do great work, but I would have appreciated a bit more of a connection at the same time. I remember asking for help with something and we'd be told, someone will get it for you soon. And I would wait what seemed like hours. I'm sure it was minutes. I'm sure you guys hear this. Yet I'd look out the room and see people, and I'm wondering, don't they know I'm sore? And I felt angry, I felt embarrassed, and I didn't want to bother anybody. I was embarrassed that I might bother you, or that you would view me as a troublemaker. So I wouldn't want to ask again. So I just wish, or with this idea of empathy that the doctor referred to, and it's not just about doing the job, it's really just the smallest little connections. It takes seconds. Are really, really appreciated and impactful. Just sharing a smile, just if it's even to say, hey, I'm here for you. I remember thinking how grateful I was that we had the experience of Caritas and that we were able to do that, to work with such an amazing team. So I would like to, if I could, share my fourth, and then we'll wrap her up, which is, I know all of us, I really recognize how hard this team works. I saw it firsthand. And just ask that if there's something you're working on and you need each other, and I saw it a lot, you reach for each other to help keep the patient first and make the patient first. So over the next few months, I went on to have a skin revision surgery as well as my stage 2, stage 3. It was 1 year to the day from the time I had my first annual innocent mastectomy to the time I finished my reconstruction stage. And I spent 4 days with the Caritas team over that period of time. And we'll come back to that in a second. I just completed my 3.5-year checkups, all good. So thank you for that. And if I could ask you to switch, I'm gonna kind of toggle through these takeaways just as a reminder for you. If there was a couple things, if you could switch to the next one for me. Just the 4 things. This ain't my first rodeo. Just a reminder, by the time people see you, they've been poked, prodded, treated disrespectfully, ignored, scheduled, and we can't stand it anymore. So and then I'm going to ask for your help in toggling through these. Just as a reminder, the idea of, does something come up? Yeah. This idea of respect and really just remembering what the patients have been through before they get to see you. The second of big hat, no cattle. You know, everybody's leaving their family, their trust, and now they're turning it over to you. And they're looking for you to have that same trust. And then the idea of really that one first second, take that chance with a patient to be empathetic, and then to work as a team to put the patients first. On behalf of Alan and I, we'd like to thank the entire team here of amazing people for your time today, for your amazing care through the toughest time of our lives, and getting us through what I call the gift of cancer. So with that, I'll shut up and would love to hear what you guys think of all that. Thank you for letting me share. Okay. Thank you.
To our very, very
please.
special donor, special friend,
Please.
grateful patient, we have a little something for you and Alan. Alan, would you come up so everybody
you,
can see the better half?
Yeah.
Because I can speak from experience. Without the spouse or that special person in your life, you can't do it. And I know you had that support.
I did.
And that makes all the difference in the world. I'd love you to open this,
Oh,
both of you.
go ahead.
You did a great job.
Thank you, sweetie.
It's beautiful.
It has our names on it. It's
Thank
a
you,
heart.
Margaret. No,
Don't, if I pick it up and drop it, I'll be really embarrassed. Can you guys see it? It's a heart. It says,
Thank you, Margaret and Alan, for your heartfelt generosity, the Caritas staff, and St. John's Health Center Foundation.
thank you. So I hope the day today is helpful. That's the bottom line.
Thank you.
Thank you.
Thanks to all of you.
Thank you.
So glad you worked out that